So why does the liver fat accumulate in the setting of insulin resistance? Now, one of the interesting features has been that, as one of the earlier speakers talked about, is that in a normal individual, insulin acts in the liver and activates FOXO1 and reduces glucose output, and it acts on SHRB1 to cause lipogenesis. But as everyone knows, when you actually have insulin resistance and type 2 diabetes, there's increased hepatic glucose output. But at the same time, they have increased liver fat. So there seems to be this split in the signaling where this part of the blockade pathway with glucose is blocked, but this part of the pathway with lipogenesis seems to remain. And the question was, why is this actually occurring? And recently there's been this paper published in JCI in animal models suggesting a mechanism of why this particularly happens. And in this group, and it seems to be that the reason why lipogenesis is activated in livers of insulin-resistant people, hopefully, presumably, but particularly in these mice, is that insulin resistance activates endoplasmic reticulum stress. So if you look at these OBOB mice, the nuclear forms of SHRB1C, which is activating lipogenesis, is increased, and fatty acid synthesis is increased. And if you overexpress this ER stress protein, which actually downregulates ER stress, then what you find is that in these OBOB animals, if you give the chaperone protein with an adenoviral vector delivery, you get reduced SREBP1C, reduced CREB, and you get reduced lipogenesis. And in fact, when they did that to these animals, you can see that SHRB1C and CREB mRNA was reduced and liver fat was reduced. So it suggests that in insulin resistance, the reason why lipogenesis is activated in the liver is because there's endoplasmic reticulum stress. There are a few other things. So insulin resistance is one of the features that causes active lipogenesis in the liver. A couple of other of the hormones that are present in the metabolic syndrome do the same thing. And this is a study that we did in patients with steatohepatitis, and we looked at leptin levels. And what you can see is that both in males and in females, as you increase liver fat, your serum leptin levels increase. And leptin normally oxidizes liver fat, but in these individuals, what's happening is that despite increasing liver leptin levels, there's increasing steatosis. So we think that there's intrahepatic leptin resistance preventing lipid oxidation within the liver. This has been adequately shown in animal models, and this is a demonstration that this is probably what's happening also in humans. Similarly, we had a talk from Professor Karawaki about adiponectin levels, and what you can see is that in patients with the fatty liver disease and steatohepatitis, after adjusting for all of the factors that we know about, adiponectin levels are reduced, and again, adiponectin levels are meant to oxidize fat. So really, steatosis in the liver is due to insulin resistance and activation of ER stress, high level intrahepatic leptin levels, and intrahepatic leptin resistance, and low levels of adiponectin. Then if you look at the export side, what's happening to triglyceride export from the liver? What you can see is in the open squares here are people who don't have fatty liver disease, and in the black squares are people with fatty liver disease, and the liver fat is measured by MRS spectroscopy. And what you can see is that in normal individuals, as you increase liver fat, there's a linear increase in VLDL secretion. Whereas in people with fatty liver disease, this begins to plateau off. So as your liver fat increases, there is no compensatory increase in VLDL triglyceride secretion, and this seems to be due to reduced ApoB secretion, so that there's less triglyceride that's being excreted. So just to summarize this part of the talk in terms of liver fat and the metabolic syndrome, firstly, liver fat predicts measures of adiposity and all the components of the liver of the metabolic syndrome. The liver fat is the most powerful determinant of insulin sensitivity, not only in the liver, but also in adipose tissue and also in muscle. Liver fat is linked to insulin resistance mediated ER stress. We know that hepatic insulin resistance is associated with atherogenic dyslipidemia, which gives you a lot of the components of the metabolic syndrome. And in terms of where the liver fat comes from, predominantly 60% comes from NEFA, but once it gets into the liver, it's the hepatic ER stress that's occurring, changes in adiponectin, changes in leptin levels, and also reduced VLDL export that causes liver fat to accumulate. There is a couple of situations where liver fat doesn't directly correlate with the metabolic syndrome. And this is the so-called Dallas Heart study of about 9,000 individuals. They did a genome-wide analysis, and they found that a protein called adiponutrient PNPLA3, if you have a mutation in this particular protein, you actually have increased liver fat. So a genetic cause of increased hepatic triglyceride due to defects in adiponutrient. And what you can see in the Dallas Heart study, if you actually have this particular allele and the GG allele of this particular mutation in adiponutrient, you have increased liver fat, but no difference between the various alleles in terms of BMI, HOMA, triglyceride. And it actually says that this is one of the only instances where liver fat seems to dissociate from the metabolic syndrome. And this particular mutation varies between ethnic groups, and this particular mutation is highest in Hispanics, and we know that Hispanics have the highest rate of fatty liver, and we know that in the European population, yes, there's more fat, but they have a less prevalence of the fatty liver.